You've got questions, we've got answers. Welcome to the Therapist Question Box, where trauma-trained therapists tackle real questions from real people. I'm your host, Lindsay, bringing you grounded insights you can actually use, brought to you by Therapy Utah. Welcome back to another episode of the Therapist Question Box. We are here to answer your mental health questions. So ask away. Whether it's asking for you or asking for a friend, we want to help you with those mental health questions. Today, we have a really interesting episode. We have Benny Locke with us, and I'll tell you a little bit about Benny, and then I'll have him also introduce himself and maybe tell us a little bit more personally about you. But Benny is a nurse practitioner. He owns Top Health, which is a mobile and telemed service, and he does a lot with body optimization. Is that how you'd explain it?
Yeah.
Okay.
Yeah.
And so we're going to be talking about GLP-1s. Everyone's talking about it, but I don't know that I've heard it talked about within the mental health space. So we're going to talk about that. But before we start, Benny, why don't you tell us a little bit about who Benny Locke is? We now know who you are professionally. Just tell us a little bit about you.
Yeah. No problem. Thank you for having me, by the way.
Yeah, thanks for being here.
So born and raised in Bluffdale. Kind of grew up a farm kid. Love Utah. I got into nursing in my early 20s. Did all the fun stuff in nursing. Trauma, ICU, ER, hospice. Became a nurse practitioner about 5 years ago and decided I wanted to do the opposite. I wanted to do preventative, regenerative care. And so that's where we're at now. So now I have kind of a cash-based telemed, telehealth, mobile service. We do a bunch of different service lines, but it's been good. I am able to build kind of that country doctor model style where you have a relationship with me and I can help you manage your care.
And you go to people's homes or do it online, is that right?
Yeah, so I go to their houses if they need like an IV for recovery, sickness, pre-travel. I do stem cell therapy, so I'll go there. I also travel out of the state, and then I do telehealth.
Cool.
So we'll do audio or visual.
When you said like the farmer doctor, is that what you said, or the cowboy doctor?
The old school
yeah, that's
country
like
doctor.
coming to your house with their medicine bag.
Their little cool bag.
That's very cool.
Yeah.
Actually, I hadn't thought about that, and I love that idea. So I like that. Benny Locke, the old country doctor.
Yeah.
I like that.
Yeah,
cool.
exactly.
Very cool. Well, this question I think is really interesting because GLP-1s, the weight loss medication, everyone's talking about it. So many people are doing it, right? But from a mental health perspective, I think like I said, there hasn't been a lot talked about. So this is going to be a really interesting conversation based on this question. So I'll go ahead and just launch into the question. And it's about how these GLP-1s could possibly be impacting mental health. So here it is. I feel a little weird even asking this, but since starting a weight loss medication, I've noticed I'm more down than usual. Nothing in my life has changed, but I don't feel like me. Could the medication I'm on be affecting my mood? What's your answer?
Absolutely, it could.
Absolutely.
Absolutely.
Interesting. Okay, so let's talk about that. Why are you saying absolute? Well, let's go back. Why are mood changes a side effect that people know about on GLP-1s?
Oh, I doubt it. I highly doubt it. A lot of times, patients, when they come to me or they'll reach out to me, all they have thought about or seen is weight loss, weight loss, weight loss, weight loss. They don't talk about any of the side effects, such as nutritional deficiencies. Could I have some hair fall out? Am I going to be tired? Am I going to be nauseous? Well, one of the other side effects that we've started to notice, especially in the newer generations, tirzepatide doesn't have it as much, but retatrutide is coming out. People are getting access to it. Is it can affect neurochemistry. So the way that the medications work is, everyone's heard GLP-1.
Mm-hmm.
Well, that's just a peptide. A peptide is a protein chain in our body. We didn't make up GLP-1s. Our intestinal tract creates that protein. But there are receptor sites for GLP-1s all throughout our body. So sometimes people think, oh, this is just a gut issue. It's the whole system is fully connected. So if you start taking these medications, it's going to blunt your appetite. It's going to slow down your gut. It's going to increase your insulin. And that's fantastic for eating less, for not having food noise. But what I've started to notice in patients is over time, if you blunt and flatten that effect, it starts to blunt those pleasure pathways in your brain.
Okay, that's really important. So you just said if you're blunting that food noise, you said, right?
Yeah.
So is that part of, okay, we have pleasure associated with food.
Yeah.
But when we're blunting that pleasure, then it can blunt other pleasure receptors in the brain, correct?
Yeah. They're not interchangeable. Our minds aren't like, okay, this is for food. This is for other pleasurable things. It's all commingled. And so we had talked earlier about my personal experience. So I like to microdose these, and I've done this on and off as I've tried to lose some body fat, change my body chemistry over the years. And I noticed I started microdosing retatrutide, and about 3 months in, I felt really depressed and really down, and that's not me. And even as a practitioner, we were chuckling about it earlier because I couldn't discover what the problem was.
Yeah, we were saying that sometimes when you're the one doing it, it's actually hard to see in yourself.
I got lab work done. I was like, maybe my sleep is off. Maybe I'm stressed. And then I talked to another practitioner, and they were like, oh, you're probably, the enhanced effect. The medication semaglutide was the first, then tirzepatide, now retatrutide. Each one has different mechanisms they've added, which make it more powerful, and it pushes the body harder and harder and harder. But that means that it's going to deplete fuel at higher rates. Our brains consume 20 to 25% of the calories you consume every day. So this organ that just sits up there, that doesn't move, is gobbling up 25% of the fuel. So if you are deficient in your fuel, I used to tell people, I'm like, there's a reason you get hangry. It's because your brain is like telling you it needs to eat.
It needs something.
Yeah. Needs fuel. You need to put gas in the tank.
Yeah.
And so if you chronically have low gas in your tank, your brain is going to respond. It's going to affect neurochemistry. And I've started to notice that with myself and patients where they'll go on retatrutide, and within a couple weeks or months, some subset of the population feels depressed. And the symptoms and side effects of GLP-1s often mimic depression. Fatigue, lack of desire, lack of motivation. They don't want to do things that they used to find enjoyable. They don't want to eat. So really what I'm hearing is like the pleasure centers of the brain are what are impacted. And so it's going to impact our motivation as well. Yeah.
So, and you would say that's on any of these?
I've noticed it more enhanced on retatrutide and semaglutide.
Okay.
For some reason, tirzepatide doesn't have as high a proclivity. Even the research indicates that.
Interesting.
So even for myself, I switched myself back to tirzepatide microdosing, and I feel way better.
Okay.
So a lot more motivated.
Once you had somebody else that was not you they could zoom out and say, wait a minute, this medication's not working. Maybe this is what's happening.
Yeah.
You go, okay. And you could see the correlation. Is that right?
Yeah.
Okay.
And I think it's the human condition. We always want the new, bright, shiny object, the new thing that's going to work even better. It doesn't necessarily, just because it's newer and has a new mechanism and everyone and your gym friend is taking it, that Instagram influencer is taking it, doesn't mean that that's the right option for you.
I think that's a really important thing, because I have heard people say, you know what, I don't know how to do this anymore. Everyone's thin. It's like maybe people want to take it and they do. And then other people that don't want to take it, it's like, but we're now playing on, it's a different playing field. Because it doesn't feel, it's what's being used is totally different, right? So I'm with you. I think it's kind of this bright, shiny new object, and maybe the newest one. It's interesting, like you're saying, that the newest one, retatrutide, is actually causing some of these problems.
Yeah.
But what would you say to people that are saying, you know what, okay, I do want the weight loss benefits, but I have some fear about the side effects, right? Whether it be from like the actual medication itself, or that you were saying it's actually some of the effects of what happens when you're taking it. So I guess it's both from the medication, but what would you tell people? Because I know it doesn't impact everyone the same way, but what would you tell people around that?
So the way I view these meds are like a tool in your tool belt. If you told me that you were tired every day of your life, but then you also told me that you went to bed late and you didn't sleep well, we're going to focus on those small things, right? I'm going to be like, okay, go to bed earlier, sleep better. With weight loss, sometimes people think this is a fix, and I just think it's a tool to use and utilize. Yes, you can take the meds, but they're going to help you eat less. It's going to help you make better food choices, and it's going to put you in a position to change your behavior and your habits for the long term. So it's like, okay, you've been given a gift where you have added control over food. Awesome. Can you now optimize your sleep? Can you get to the gym and do something or do some kind of exercise? And I feel like it's small steps. You know, when people see small successes, oh, I've lost 8 pounds. Cool. It's a lot easier to eat better. And then it's a lot easier to go to bed a little earlier. And then it's a lot easier. So I feel like it's a stair stepping.
I like that. So it's one good thing leads to another good thing. There's some momentum that happens.
Yeah.
And that this can be a tool with that momentum, or to maybe jumpstart that momentum.
Yeah.
So that's interesting, because that's one side of it. But then we can have the other side where motivation can go down, like you talked about, not wanting to do anything. So how can we tell, like, okay, this is a chemical thing going on, or situationally things are hard for me? What are your thoughts?
I think reaching out is always better than reaching in. A lot of patients use AI. That is not reaching out. We're not built for connections with machines. We're built for human connection. I love
that, by the way, reaching out versus reaching in. I haven't used that, but I love that. Yeah. That's excellent.
So I didn't tell you this. I worked in hospice for a long time, and then I worked in trauma ICU. I worked in a nursing home. So I've seen a lot of people pass away, a lot, hundreds. And no one at the end of their life is like, oh man, I love the relationship I have with my truck. Like, that's not a thing, right? People always talk about who they are connected with, who they love, and memories.
That's right.
And so for me, it's if you are struggling with, you know, I am loving the weight loss I'm getting, but man, I am not loving how I'm feeling mentally, talk to someone.
Yep.
And maybe this is a pitch on my end, but this is why it's nice to have a practitioner you can talk to that you actually trust, that you know is not going to judge you. There's a lot of really awesome practitioners out there who want to do it right, who want to connect with their patients, who want to help them. But I feel like sometimes patients they don't know that those options are available.
That makes a lot of sense, that they don't know what's available. So to be open, and it would lend itself to say that we really need to have practitioners that we feel comfortable with, that we also agree with the way they're doing it, right? Because every practitioner is not the same in the way that they're dosing, and you know, some are led by their patients and like, all right, we're going to do this quick and dirty and we're going to get it in, and others are saying, no, we're going to do this slow and steady. And so to make sure that your values are aligned with the practitioner's values as well. That they line up together. So I love that. You know, when you said that, I thought, you know, if someone like our listener is feeling different, the mood has changed, that's worth paying attention to, regardless, right? Whether it's a GLP-1, whether it is situational, but pay attention. Something's going on for you, and let's do something about it. Let's figure out what it is. Let's not just kind of keep going down this path of not being okay. So like you did, you went to another practitioner friend, is that right? And said, you know what, something is off. I don't feel motivated. Well, I got to do something. But really being our own best advocate, I think is key to actually getting clear about what's going on for us.
Yeah.
So if you were to say to our listener, what would you tell them the first step would be? They feel a little off. They've been on a GLP-1. they're not sure what's going on, what would you tell them?
I think there's probably two routes. Talk to someone immediately, family, friend, therapist.
Reach out, don't reach in.
Yeah, reach out, don't reach in. Secondly, don't be afraid to gather more data. So a lot of patients who are taking these medications, I mean, I would ask the audience, when was the last time you had lab work done?
Yes.
If you are above the age of probably 32, you should probably get lab work every year.
Really?
Yeah.
Really?
A lot can change. A lot can change. Especially you ladies. Your bodies are like these crazy, sophisticated
it is not
things.
fair. I'll tell you that right
Us
now.
men, we're dumb cavemen creatures. You guys are like these wild unicorns that we don't fully understand. But
well, we're trying to understand ourselves too, by the way, for the record. So there's that.
But you know, so like for example, I had a buddy who he came to me and he's like, "Hey, I think I have low testosterone. I want to check my labs." And I was like, "When was the last time you had lab done?" He's 38 years old. He's like, "Oh, I haven't had them done in probably a decade." We check his labs. It's not his testosterone at all. He had Hashimoto's. He has a thyroid condition. So he goes to an endocrinologist, a specialist. I was like, "Yeah, you should go to a specialist. I don't do that advanced stuff." Gets dialed in on meds, feels 100% better. Now, if he had just pushed through or thought, "Oh, I'm just tired, this is just part of being 38 and having young kids," or whatever, he could have validated that. But there could be things going on. You know, I've had, and then maybe evaluate your situational. You know, if you've had a relative pass away, if you have stress at your job, like those are going to compound. When you take GLPs, your body is going to, if you have less calories, your body's going to eat your fat stores and your glycogen. And so our bodies don't like to do that. We have thousands of years of evolution built into us where, you know, we feel like we're going to starve to death if we miss one meal. Mm-hmm. And so if you compound all of that together and then you add stress that you're not managing in other ways, it can really exacerbate. So there needs to be a lot of self-reflection. You need to have a good relationship with where you're getting these medications, your prescribing provider, and feel free to be open. You know, I've had patients who come that they say they feel great, but they feel like their intimacy drive has really dipped and they don't like that. And so we come up with a game plan on how to still get them a result, but get that part of their life back.
Interesting. And that requires safety and trust with the practitioner
to
have that kind of honest conversation. But also find a practitioner that's willing to have a discussion like that with you and not just say, nope, I don't know, that maybe it's because you're old, maybe it's because you're tired, but really look at it and be proactive. I like that you said, you know, you went from the reactive side of healthcare to the proactive side of healthcare. And I think that's a practitioner that's willing to say, you know what, let's look at this. Let's try to manage things and really try to be an assist to that patient and not just say, you know what, well, I don't know, we'll throw this at you, we'll throw that at you. But no, like, let's really dial it in and figure out what's going on for you. I love the idea too of just talk to someone. It doesn't even need to be that you're going to the doctor or a therapist. Talk to your friend, talk to your spouse, talk to your family. Like, just open up about it. Because when we start to open up, then we start to feel safer in talking about it, right, with somebody else. Yeah. I think there is this interesting thing of there's, I think, some shame associated with GLP-1s. As normalized as they have been, I think there's still this kind of quiet shame around it. So just talking about it with other people, I think, is a big deal.
Yeah.
Yeah.
And I think a lot of that shame comes from misunderstanding what these medications are. They might go down as some of the greatest medical like innovations of like our time, just because of the vast reach of what they can do. Like, I've had people who look at me and they don't realize I was, you know, I'm 5'6" and I was 225 pounds. So I was a chunkier boy, you know, and now I'm in a much better station and I take microdose because it helps with other conditions and other things. And so sometimes I think people are afraid of that judgment. They're afraid of the shame, but everyone has something. Everyone's going through something.
Amen.
And I actually have found that the more I talk openly with my patients, the more that they will relate back to me. So I, as a practitioner, I'm pretty vulnerable with them. I tell them a lot about my journey, and I find that they reciprocate that well.
I love that. I actually think that's the same thing in therapy. When you can be honest and open, let the client know that you're a human too, and that all these things that you're talking to them about aren't easy, that maybe you have to go to another practitioner and say, hey, I don't feel good. What's going on? And sometimes we need an outside voice to tell us, hey, let me tell you what's going on. This is a new medication you're on. Maybe you're not seeing it. Yeah, because it's hard to see sometimes in ourselves what others can see in us, right? So absolutely. I really appreciate that. Is there anything before we end that you feel like we need to talk about that we haven't hit on?
With GLPs?
Mm-hmm. Yeah, with GLPs and with understanding our mental health and how they might be associated.
The one pitch I would make is that we're not disconnected beings. They're all the same. There's nothing wrong with wanting to have different body composition, looking better in a bathing suit, feeling better about, there is nothing wrong with that. But there is also nothing wrong with balance. My wife and I usually pick a word for the year, right? We pick a word in January. We don't make goals. We pick a word and we try and live that word, right?
Nice. Yeah.
And my word, I've had to repeat it from last year because I wasn't great at it, is...
you got the same word this year?
Oh, I pulled it out, yeah. It's like I'm going to...
Sorry.
My word this year is still consistency. And I have found that if you are consistent, success usually comes in whatever you're looking for. So if patients are on GLPs right now and they're feeling flat, they're feeling like they just don't desire things, they're not having that connection, reach out to their provider. If they don't like their provider, find a provider you like. There's tons of them. There are hundreds of people that prescribe and do all these things. And find a community that will support you in your goals because they're out there.
Yeah, I love that. That success comes in whatever you're looking for. Amen. You can find it if you're looking for it. I love a couple of things that you said that I just want to recap on. It's a tool in your tool belt. That it's a tool, but it's not everything. So continuing to eat well and sleep and exercise. I can't tell you how many clients I've met with, and I would say every therapist, it's like, how is your sleep? How is your eating? How is your exercise? Those are really basic. And it feels like, oh yeah, that's too basic. No, it's actually really basic. And that's why it matters so much, right? Those are the building blocks. So I love that you said it's just a tool. Don't use it as everything and then throw out all the good habits, or there's going to be a problem, including your mental health. It's going to be a problem. I love the reminder to talk to somebody, just talk to somebody. If you're feeling off, talk to somebody. Doing lab work every year. That was information for me. I didn't know every year I should be doing lab work. Yeah, probably should be. So, I thought that was excellent. And again, that we are connected beings, that we are meant to be connected. I love the idea of reaching out before you reach in. Reach out. We're meant to connect to each other, and we need each other, whether it's mental health, physical health. We need to be connected. We are wired for connection. Well, Benny, really appreciate the insights and appreciate you sharing your story with us as well. And I know this episode will be helpful because there are a lot of listeners that are on these medications. And so understanding not just the physical part, but the mental health part as well, I think is a really valuable information. So thank you so much.
Thank you for having me.
Thank you so much for joining us for this episode. We hope it was helpful for you. If you find it helpful and beneficial, please like and subscribe and share it with a friend. And until next time, take care. That's a wrap for today on the Therapist Question Box. I'm Lindsay Schiss. Thanks for listening. And remember, every question you ask is an opportunity to learn and grow. Brought to you by Therapy Utah.
Hey, this is Kathy Kinghorn. I'm an owner at Therapy Utah. If you'd like to book with one of our trauma-trained therapists, go to www.therapyutah.org. Thanks for listening.